Spinal disc problems are widely misunderstood for a number of reasons, partly because of the plethora of terms used to describe the disc-related pain, such as a pinched nerve, degenerated disc, slipped disc, herniated disc, bulging disc, and so on. Dr. Craig Livesay is here from the Spinal Corrective Center, and he's going to clarify disc disease and what can be done to help. Welcome back.
Glad to be here.
I'm glad you brought sushi with you.
Yeah, we got some models
looks
with
like
us
sushi,
here
doesn't
today.
it? Yeah.
I don't know what kind of sushi you've been
Okay.
eating.
All right.
Well, one of the most common things when patients come into the office, one of the terms that they will say is, I've been told I have a slipped disc. And I kind of cringe at that because there is no such thing as a slipped disc. The disc can bulge, it can herniate, it can prolapse, a lot of fancy terms.
Well, let's start with the disc. What is the disc?
The disc is this
Spongy part?
Spongy part. I would actually say a sponge is a good representation because if that disc is healthy, it is like a wet sponge. You know, when you pick it up off the back of the sink and it's wet, it's got some flexibility. It moves around. However, if that sponge has been laying there for a couple of days and you go to pick it up, it's kind of hard and brittle.
Yeah.
A lot of patients' discs in their bodies are kind of hard and brittle because they've not been moving properly. So, you know, just like the guy in this picture here that's carrying the load of lumber up over his shoulder, it's hard and brittle and it can snap. And what will happen is you'll tear those fibers. And when you tear those fibers, I don't know if the audience can see, but you can see the red material right there. That's when that disc...
So is activity the answer?
Correct motion is the answer.
Okay.
When things are misaligned, it tends to create that wear and tear. And when you get that misalignment and those disc fibers tear, that will lead to that bulging disc, or even worse would be the herniated disc. But the question becomes, can I be adjusted chiropractically when I have those bulging or those herniated discs? And the answer is yes, especially with the Pro Adjuster.
With the new Pro Adjuster. All right, for people who haven't seen this, tell them about the new way they can be adjusted without being manhandled, so to speak.
Instead of popping, cracking, or twisting, which if you have a bulge or a herniation, you don't want to be twisted because more than likely that's how you got in that condition to begin with. So with the Pro Adjuster, we're able to go directly straight through the joint, push that joint back up, and get it aligned properly. There's that mechanical impulse. We always emphasize that it is a mechanical impulse into the joint, not an electrical impulse. And it only uses about 5 pounds of pressure. I mean, you've experienced it right here on the show, and it doesn't hurt.
Well, it's just like a tapping.
A tapping, and since that disc is actually a vacuum, when we move the vertebra, the disc has to go with it. It's not going to stay right there on the nerve causing the pain. So when the vertebra moves back, the pain will go away.
So this is a much better treatment for that than something you could have done before?
Yeah, much better and a lot safer for the patient. You know, if they're already in pain, they don't like the idea of somebody, you know, grabbing them, like you said, manhandling or twisting them. So if we can align that back, take the pressure off, we can actually help correct or lead them back towards health, alleviating that disc herniation or that disc bulge. But it's never a slipped disc.
And with your experience doing it the old way, you knew what you were doing and that more than likely it was corrected, but with this, it actually shows up on the screen here if it's corrected or not, and if not, you can give them another gentle tapping that puts it right in place.
You adjust them that one time, and you can look on the screen when it shows that resistance. The bars come up here, so if the resistance decreases, let's say 50%, we may go over that one more time to take it down another 50%. So I kind of already know. I'm already smiling before the patient ever stands up, and I'm like, so how does that feel? And they're like, wow, that's amazing. So through the rest of this month, through September, the initial exam, consultation, and X-ray, it's only $39. Now that is we have limited spaces left through September, but if you'd like to come in, we'll do the consultation, exam, X-ray. It's $39. That's normally $210.
Okay. Well, and tell them you saw it right here on Daytime, and thanks for coming on Daytime. And if this is you, give Dr. Craig a call. Thanks so much for being with us. Hey, when we come back, we're going to be talking about the Reese Museum over at ETSU and something new they got going on.